doctors, nurses, and pediatricians recommend West Virginians 12 and older get a COVID-19 vaccine because it's the best protection from COVID. Protect yourself and others. Talk to your doctor or trusted healthcare provider about getting vaccinated. COVID-19 is still here, and the new Delta variant is stronger and more contagious than ever, and it's causing cases to rise across the country. If you're unvaccinated, you're at the greatest risk. Vaccination is the best protection from COVID. The vaccines are proven to lower the risk of infection and prevent serious illness and death. It's why doctors and pediatricians recommend that West Virginians 12 and older get one. You can protect yourself from COVID by getting vaccinated.
Hi, I'm Dr. Joanna Bailey. I'm a family physician working in Southern West Virginia. As a family doctor, I get the pleasure of getting to take care of patients of all ages. I frequently care for pregnant women, breastfeeding women, and young children. Some of my patients have asked me whether people who are pregnant or breastfeeding should get the COVID-19 vaccine. The answer is yes. Pregnant and breastfeeding women across the country have chosen to get the COVID-19 vaccine since it was authorized. In that time, vaccine safety monitoring has shown that the COVID-19 vaccines are safe for pregnant patients and their babies. There are many reasons why I recommend the COVID-19 vaccination to my patients who are pregnant or breastfeeding. For one, pregnant women have a higher risk of severe illness or experience preterm birth if they get COVID-19. These bad outcomes can potentially be prevented by getting the COVID-19 vaccine. For another, those who are vaccinated when breastfeeding may have the added benefit of passing immunity onto their babies through their breast milk, which can help protect the newborn from the virus as well. In addition to recommending vaccination to my pregnant and breastfeeding patients, I also strongly recommend that those who are close to them get vaccinated. This helps build a protective cocoon of immunity around the caregivers and their babies. If you have questions about COVID-19 vaccination during pregnancy or when breastfeeding, contact a healthcare provider. Thank you for watching. I'm Dr. Joanna Bailey.
Hi, I'm Fred Wooten, Commissioner of the West Virginia Alcohol Beverage Control Administration. I know we all enjoy a night out with family and friends in our bars and restaurants, and I want to make sure we can keep our businesses open and operating at 100% capacity. That's why I need you to get vaccinated against COVID-19. The vaccine is free and available in clinics and pharmacies across the state. Find a vaccine location near you by visiting vaccine.wv.gov. So please get vaccinated, wash your hands, and stay home when you're sick, and we can keep our bars and restaurants open at 100%. Together, we can fight COVID-19. Thank you.
Hi, I'm Dr. David Hess, and I'm a primary care physician in West Virginia, and have been practicing medicine now for nearly 20 years, seeing tens of thousands of adults and children in my career. My patients sometimes ask me if the COVID vaccines are safe. My answer is yes. COVID vaccines are safe. They were first evaluated in tens of thousands of people who volunteered to participate in clinical trials. These clinical trials followed the same thorough safety and efficacy standards that the FDA sets for all vaccines in the United States. Since then, millions of people in the United States and around the world have received COVID-19 vaccines, and the results from the U.S. and global safety monitoring efforts are excellent. There are rigorous systems in place to quickly identify any safety concerns and take action. These monitoring systems provide information that allows public health and medical experts to update the recommendations and guidelines as needed to ensure COVID-19 vaccination is safe. When it comes down to it, COVID-19 vaccines are safe and effective. Vaccinations save lives. That's why I chose to be vaccinated and why I recommend COVID-19 vaccination to my patients and my family. Thanks for tuning in. I'm Dr. David Hess. For more information about COVID-19 vaccines or to find a location near you, visit vaccinate.wv.gov.
Hello, everyone. It's Wednesday, September the 29th. As I've told you over and over, we're going through almost the eye of the storm right now. We think that we're at the peak level to where, this surge could very well start down, and we're very, very hopeful that that's going to happen, along with being very prayerful. But at the same time, we know at any level of peak, we lose a lot of people. We've lost 74 people since Monday. I ask you again, join me in your prayers. Out of total respect, I absolutely want to read all these people, all their names or their gender, their age, and the county. 3,642 right now. I keep reminding everybody all across this wonderful state that the way we absolutely curb this and stop this is get vaccinated. I also encourage you right now, if you're 18 and above, you can get your booster shot, and absolutely you need to move forward if you're 6 months out from when you've had your last vaccination and you got a Pfizer vaccination. The 3,569th death in West Virginia is a 43-year-old female from Marion County. The 3,570th death of 75-year-old male from Kanawha County. The 3,571st death of 72-year-old female from Marion County. The 3,572nd death of 43-year-old male from Wood County. The 3,573rd death of 71-year-old male from Hampshire County. The 3,574th death of 72-year-old female from Preston County. The 3,575th death, a 92-year-old female from Mineral County. The 3,576th death, an 89-year-old female from Kanawha County. The 3,577th death, a 97-year-old female from Marion County. The 3,578th death, a 36-year-old male from Cabell County. The 3,579th death, a 75-year-old female from Upshur County. The 3,580th death, a 74-year-old male from Clay County. The 3,581st death, an 86-year-old female from Doddridge County. The 3,582nd death, a 68-year-old male from Raleigh County. The 3,583rd death, an 87-year-old female from Kanawha County. The 3,584th death, a 97-year-old female from Marshall County. The 3,585th death, a 71-year-old female from Berkeley County. The 3,586th death, an 86-year-old female from Raleigh County. The 3,587th death, a 79-year-old female from Upshur County. The 3,588th death, a 60-year-old male from Preston County. The 3,589th death, a 65-year-old female from Fayette County. The 3,590th death, a 62-year-old female from Harrison County. The 3,591st death, an 80-year-old male from Harrison County. The 3,592nd death, a 72-year-old male from Logan County. The 3,593rd death, a 93-year-old female from Pleasance County. The 3,594th death, a 94-year-old male from Jefferson County. The 3,595th death, a 74-year-old male from Harrison County. The 3,596th death, a 72-year-old male from Harrison County. The 3,597th death, a 61-year-old female from Wayne County. The 3,598th death, a 76-year-old female from Harrison County. The 3,599th death, a 44-year-old male from Hancock County. The 3,600th death in West Virginia is a 69-year-old male from Monongalia County. The 3,601st death, an 81-year-old female from Fayette County. The 3,602nd death, a 78-year-old female from Tucker County. The 3,603rd death, a 52-year-old female from Doddridge County. The 3,604th death is an 87-year-old female from Upshur County. Now we've got 38 additional deaths that were reported to us today as a result of the DHHR's continuing reconciliation of the official death certificates, and as we get these in, we'll report these just as we're doing right now. The 3,605th death is an 88-year-old female from Lincoln County. The 3,606th death is a 67-year-old female from Clay County. The 3,607th death is a 53-year-old male from Upshur County. The 3,608th death is a 74-year-old male from Harrison County. The 3,609th death is a 51-year-old male from Kanawha County. The 3,610th death is a 68-year-old male from Pleasance County. The 3,611th death is a 48-year-old female from Jackson County. The 3,612th death is a 73-year-old male from Wetzel County. The 3,613th death is a 76-year-old female from Monongalia County. The 3,614th death is a 66-year-old male from Kanawha County. The 3,615th death is a 75-year-old male from Tyler County. The 3,616th death, a 91-year-old male from Wetzel County. The 3,617th death is a 69-year-old male from Hancock County. The 3,618th death, a 54-year-old male from Cabell County. The 3,619th death, a 67-year-old female from Randolph County. The 3,620th death, an 86-year-old male from Monongalia County. The 3,621st death, a 77-year-old male from Upshur County. The 3,622nd death, a 64-year-old female from Marshall County. The 3,623rd death, a 79-year-old male from Calhoun County. The 3,624th death, a 67-year-old male from Upshur County. The 3,625th death, a 77-year-old male from Nicholas County. The 3,626th death, a 50-year-old female from Clay County. The 3,627th death, an 88-year-old female from Harrison County. The 3,628th death, a 53-year-old female from Wetzel County. The 3,629th death is a 68-year-old male from Kanawha County. The 3,630th death is a 76-year-old female from Cabell County. The 3,631st death is a 54-year-old female from Marion County. The 3,632nd death is a 76-year-old male from Boone County. The 3,633rd death is a 53-year-old male from Mercer County. The 3,634th death is a 57-year-old male from Upshur County. The 3,635th death is a 75-year-old male from Fayette County. The 3,636th death is a 77-year-old female from Gilmer County. The 3,637th death is a 54-year-old male from Tyler County. The 3,638th death is a 58-year-old male from Randolph County. The 3,639th death is a 53-year-old male from Wetzel County. The 3,640th death is a 63-year-old female from Boone County. The 3,641st death is a 64-year-old male from Kanawha County. And the 3,642nd death in West Virginia is a 72-year-old male from Wood County. I'm telling you. You may think that it's just sitting here reading, genders or counties or ages, but this has a real impact, and it's really sad. It's really, really sad. And to these families right here, to the loved ones of these people, it's tragic. I mean, it's just terrible. And it's tough on all of us, but it's super tough on them. Please remember them. Please remember them. Don't let these days just reel by one right after the other and not really, really take to heart all this reading that we're doing. These are people with names. These are people with loved ones. These are people that have given so much to West Virginia, to all of us. 13,000 active cases is down again. The active cases are looking better. The new positive cases are still high but better, 1,496. Daily positivity rate at 9.54, which is still really high. Cumulative continues to move towards 6% at 5.86. Recovered cases are 221,000 in West Virginia. The number of hospitalized people are 974, and that's down just a little bit. But our ICU numbers are now at a new record high with 298 people in the ICU. 187 people are on ventilators, and that's down just a little bit. And we've got 4 green counties in the state. There's absolutely every reason to believe we're right in the eye of the storm. we're right at the peak of the surge right now. We're going to lose a bunch more people, West Virginia. There's no question about that. But in all of that, absolutely for them, for respect for them, I truly believe that all we've got, all we can possibly do to stop this is to get vaccinated. That's all we can do. Now, whatever it may be, we can't have all these people just die in vain and have this just continue to go and continue to go. Now, I'd be the first to say, I reiterated it again last night on Fox News with Brian Kilmeade. And absolutely, with all in me, I do not feel comfortable with this mandate stuff and everything, because first and foremost, we are Americans, and we do have our freedoms. And we do not want to divide us even more, do we? I mean, do we want to absolutely fragment us even more and more? We're way too divided as a nation in the first place. So with all that, all I can possibly do with a good conscience is continue to urge you in every way to get vaccinated. The boosters are open. We need a run on the bank. A lot of people have responded. And as we continue to move through our nursing homes and everything with Pfizer, we're making tremendous headway in a lot of different areas. As soon as we get Moderna or the J&J number, you know, the recommendations that we're allowed to move forward there, we'll move forward right there as quickly as possible to get the folks their boosters. We got 4 green counties: Pocahontas, Tucker, Pendleton, and Calhoun counties. The map looks a little bit better. We have 72 outbreaks in our schools in 26 counties with 813 students that are confirmed. We have 54 counties that have mask mandates for K through 12. The only county that doesn't is Pocahontas. We continue to have a slow but sure rise in the people that are hospitalized that are vaccinated. And what does that tell us? It tells us just simply that the boosters, that the vaccine is wearing off. And absolutely, if you can get that booster shot and you're 6 months out, it's what you should be doing. Okay, reminder, you know, if you have any kind of issue or medical, you know, problem or just anxiety or whatever it may be, and especially if you're 65 and above, you've got to go get tested. That's all there is to it. You've got to go quickly to get tested. And if we catch it early, we'll give you the antibodies. As I've said over and over and over, we'll get rid of this thing. I've gone through all the stuff about boosters. I would recommend to you, if you're in a crowd of people indoors, a significant crowd of people, and you're 65 and above, and you're compromised with diabetes or whatever it may be, you probably really, really need to think really hard about wearing a mask. As far as where you can get your shot, you know, all you got to do is take your vaccine card and go anywhere giving out vaccines, and you'll get your booster right then. You know, but and if you've lost a card, get in touch with us. We'll get you a new card. Just call into our hotline there number, and we'll get you a new card. The National Guard, as we've said over and over and over, is ready to go. They're working it night and day. The National Guard, local health departments, local pharmacies, healthcare facilities, you know, everyone's out there ready to go on this booster, and they've got them. And so take advantage, West Virginia. You've led the nation over and over in a lot of different categories. Lead the nation in getting your booster shots. Absolutely, it will take some level of stress off of our hospitals. You know, our hospitals are doing all they can do. We do not want to get in a situation where we've overloaded our hospitals and we can't even take care of people that are having heart attacks or strokes or whatever it may be. Absolutely, you can do your part again. You already have in being vaccinated, but you can do your part again in going to get your booster shot to keep you out of the hospital, to where really and truly we're not overloading our hospitals even more. We gave out, well, I guess the bottom line is we crossed across 1 million people in West Virginia that now have their first shot. We had to back up on the numbers. We took a little cannonball to the stomach in regard to the CDC's fault. You know, we've not given out as many doses in the last, I guess, 24 hours as I'd like to see. We've got to give more and more and more. We have 64% of our people that have now received, 64.5% that are 12 and older have received at least one shot. 86.8% have received one shot of the 50 and olders, and 92.7% of the 65 and older. So some numbers good, some numbers we can do better. We absolutely need to just keep pouring it on. We've got 224,000 people that have signed up for the Do It for Baby Dog Round 2 stuff. People win stuff here. You need to get registered and everything, but more than anything, get vaccinated. That's what the whole message is, and it gives us a platform to be out in front of a bunch of kids and everything, and especially I love the fact, you know, that we're giving scholarships away and opportunities to our young folks, and in some situations we're really hitting people that may not have the opportunity to go to school, and this gives them that breath of fresh air and a real you know, hope and everything as we move forward. Vaccine eligibility, 12 and up, young people, you need to get vaccinated. The weather's going to get bad. Absolutely, as soon as the weather gets bad, we stay inside. The likelihood of you ending up with COVID and everything from this Delta variant being highly infectious and being inside is pretty daggum high. Absolutely, the possibility of side effects, you know, if you're a young person and everything, is real. From the standpoint, if you're a parent, I just don't see how in the world you don't decide to get your kids vaccinated, even if you choose not to, because those kids depend on you. They really depend on you. This vaccine is incredibly safe. It'll help all of us, but absolutely I worry about those side effects with our young people more than anything. Grand families, got 19,000. Take advantage of this voucher and everything. Get those kids vaccinated. Help us. All the information on the vaccine info line's up. All the testing is free. We thank Frutz. We thank Walgreens over and over for all that they've done. We're down a little bit in our outbreaks in our long-term care facilities at 77. We only have one active outbreak in our church community. Way to go. Way to go to all of our church community. Great, great, great work. You know, we all know the churches are a big-time area where this can spread and it can cause all kinds of issues, but only one county, Wayne County, the only one that we have in the state. That's really good. As far as corrections, we have 260 cases, inmate cases. We're doing some additional digging here, and I don't really have any answers to it right yet, but Kenny Bass was good enough to bring to our attention, that we may have some inmates that are still, looking for vaccines and everything, and we've got to get those vaccines to them. And we want to just keep digging in that and everything in every way, and get to the bottom of it to see if it's real or not real. But we're getting to the bottom of it right now. We have not, found any evidence that be the case, but we're offering vaccines to all the inmates in all the jails, and if we find that, we're going to run to the fire and take care of it. As far as giving blood and plasma and everything, I recommend that to all of you. We continue to work with all the hospitals. We're going to help our hospitals in every way. We've got to keep our hospitals up and running to be able to serve our people and everything. And we're going to absolutely stand arm in arm with them and get them through this, and get them through the financial end of it, and any additional help we can send their way, we're going to be able to do so. And I remind everybody about getting your flu shot. You can take your flu shot and your COVID shot at the same time. And I remind everybody to do that. You know, it's getting ready to get cold, like I said. Flu season's right on us. Thank you a bunch.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. And reinforcing a couple of the points the governor has made, we do believe from looking at some of the parameters that we follow, as the governor said, we are at the peak of the inverted V-shaped curve and hope to be coming down soon. We see a reduction, as we said last press brief, in about 200 average daily cases over the last week. We have also seen our reproductive value be under 1 for the last 3 days in the state. And we see some of our counties that are changing fall-like colors, which is good news for us, away from red, more to orange and yellow. When we look at the impact of boosters, what the governor said is also really important, in that about 20% of our hospitalizations are in people that are fully vaccinated. And when we dive into that, which is also on the DHHR dashboard, and we look at the impact of vaccine breakthrough cases in people who have died in West Virginia, and the governor is reading a lot of names at every press brief, which we very much want to do all we can to reduce. But when we look at deaths, and we look at deaths since the vaccines became available, we see that about 6% of West Virginians who've been fully vaccinated have died that have been vaccinated since the vaccines became available in December. And when we look at the ages, we find that over 80% of those deaths have occurred in West Virginians that are over 70 years old who are fully vaccinated. So this is a really important opportunity for us. And if we really can have a great uptake of the booster shots, particularly right now, the people that have had Pfizer vaccine and are 6 months from their last vaccine, then basically, as the governor has pointed out, there's likely a category that every West Virginian can get a booster shot. And when we look at Israel, we know because of the real aggressive vaccination rates that Israel had, that at one point, over 60% of their hospitalized patients were fully vaccinated. And when they gave their citizens the booster, they have seen that rate of people who are fully vaccinated being exposed to any severe problems go way down. And today in Israeli hospitals, the 17% of their population that's unvaccinated now accounts for over 60% of their hospitalizations. So they saw a real turn from people who had severe complications of COVID-19 who are fully vaccinated with the booster shot. So please go get your booster shot. That is really, really important. Moderna has applied with the FDA, submitted their data and about a booster shot as well. And the at least thought that's coming out is that may be a booster shot with half the amount of vaccine that was initially given with Moderna. Remember, the Pfizer vaccine for Americans 12 and older is a 30 microgram dose of the vaccine. Moderna, in their shots, were 100 micrograms of vaccine, over 3 times as much. And because of the potentiation, the benefit, the lack of loss of potency that we saw with Pfizer, Moderna thinks that the dose can be reduced, and that with the FDA is at least what we're getting signaled might happen. Also, Pfizer has submitted their data on the under 12-year-old, the 5 to 11-year-olds, and we anticipate that will go in front of the FDA at some point in the near future, and we'll hope to get approval so that 5 to 11-year-olds can get the vaccine within a month or so. So West Virginia, please go get your boosters. If you haven't been vaccinated already, please do that. Really important moment for us related, as the governor said, to the hospital capacity. But staying together, we are weathering the storm, and God willing, we will continue to see COVID-19 dissipate and give us back the liberties and the safety that we very much all want. Thank you.
Thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. I'd like to update you on nursing home booster progress. First, just overall nursing home vaccination levels. In our call with the nursing home leadership this morning, we understand that 87% of all residents are vaccinated and 70% of the staff are now fully vaccinated. As it relates to Pfizer boosters specifically, which we started last week, we were told this morning that the majority of all those facilities will be complete by Friday, and all facilities for the Pfizer booster will be completed early next week. So once again, West Virginia, you're doing an exceptional job of leading the nation and getting those booster doses in the arms of the people that need them. As the governor and Clay have pointed out, our breakthrough cases at 20% in the hospitals are primarily our older, more vulnerable citizens with vulnerable health issues. So we continue to work that. Antibodies, we continue to sign up facilities. There is process that we go through with DHHR team and HHS to get that done. We did receive an increase in the available antibodies. We are specifically in West Virginia focused on the Regeneron subcutaneous doses, which are more easy to administer, although our hospitals will continue to get the IV doses. Again, point out that, as the governor pointed out, 64.5%, 12 and above, have received at least one dose. Our trend line continues to go up, but as the governor points out, and we all point out, just not fast enough. We've got to get faster at this. We've got to get more people educated. And let me put it, to close out and put it in this context for you. Spent a lot of time with the governor in 2016, going through the mud in a lot of different places related to the response to the 2016 1,000-year flood event. A 1,000-year flood event, 2016, we lost 23 great West Virginians, to include a young lady that we spent weeks trying to find her, recover her body. Take that and divide that number into 3,642. We've gone through the equivalent of 158 2016 flood events of loss of life. We created all kinds of committees. We did all kinds of work to mitigate future threats related to flooding. We've got to get people educated, and we've got to get vaccinated so that doesn't go up to 200 or 300 equivalent 2016 flood events. So West Virginia, please get educated on the value of the vaccine and get vaccinated. Thank you.
Thank you, sir. Next to Dr. Ayn Amjad, our State Health Officer.
Good morning. We had a question on Monday about visitations to hospitals and long-term care facilities for COVID-positive patients. And I just want to remind everyone that the hospitals and long-term care facilities had to readjust some of their visitation policies in order to keep patients safe and families and other staff safe. So we do want to remind everyone that some places do have some visitation policies. You might have to call the facility first. But the West Virginia legislature did pass a law early on so that COVID-positive patients, if they're very sick and maybe they might not have many days to live, that there is a law that's passed that if you do call, that you do have the ability to see them at any time that you want. So there is no restrictions for that. But some facilities do have visitation hours so that you do have to call before you visit them. But we do want to ensure you that patients and staff, they do try other ways to see your family members. Sometimes they use iPads, FaceTime, phone calls, but a lot of the places you just might have to call and make an appointment for those facilities. Thank you.
Thank you, Dr. Amjad. Secretary Bill Crouch with the DHHR had a prior engagement and will rejoin us on Friday. We'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media.
Good morning, Governor and cabinet members and staff and fellow reporters. Governor, I'm curious about this, and I wish General Crane was with us today, but perhaps General Hoyer can offer some insight. If we're looking at the possibility of a federal government shutdown, if they don't reach a budget agreement by the 1st, how will that affect our National Guard in terms of its ability to do all of its functions, but in particular, the response to COVID-19?
I can answer it. It's not going to affect our National Guard. That's all there is to it. I'm not going to let that happen. There's no way on this earth that it's going to affect our National Guard. It's not going to affect their training. It's not going to affect their benefits. It's not going to affect their pay. If we've got to step up at the state and cover this until our government in Washington can figure out how to walk up the steps and chew gum at the same time, we'll cover it. And you know, we'll, whatever we got to do, if we've got to convert active duty folks, you know, if we need to do so, we'll do that. Whatever we got to do, we'll do. You know, it is the 6th time. I mean, this is the 6th time in the last, I don't know, 3 or 4 years that we've been through the same drill. And then at the 11th hour, DC decides, oh, well, we'll fix it, or we'll put, you know, a Band-Aid on cancer, basically, is what you're talking about. You know, it is a shame. That's all there is to it. These great people especially have stepped up at our National Guard and done so much good work, it's unbelievable. It is flat unbelievable. And how in the world we can put them through this, of all people, I don't get it. I just plain don't get it. But Mark, thanks for your question. Absolutely. That gives us a platform to be able to tell all these folks that they can rest easy. Everything's good in the neighborhood in West Virginia, and we're going to take care of them.
All right, thank you, Mark. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to follow up on the question I asked Monday about exactly how many booster shots we've given out. You know, I know on the dashboard we list the additional doses, but, you know, on Thursday, Friday, before the boosters were authorized, that number was at 11,000 something. Now it's at 14,000. So could somebody explain how many of those are additional doses? How many of those are boosters? And what is the reason that we're lumping those two figures together? Thank you.
Okay, General, you got to take this one, sir.
Yes, sir, Governor. So, Charles, it's the way the systems, the federal systems and our state systems allow us to track and report, and those two are tracked together. We'll continue to give you more updated numbers, and I'll reach out to you with some specific additional updates that try to divide those down a little bit better. But again, it's the way the systems are set up to receive data similar to what we dealt with in the past related to other data. Thank you.
All right, thank you, Charles. Next, we'll go to Annie Moore with WVVA.
Good afternoon, Governor. Good afternoon, everyone. I was just wondering what the update is on ventilators. I know at last check, I think that was about 2 weeks ago, there seemed to be plenty available. Is that still the case? Are we needing additional resources from the feds?
Okay, Annie, how you doing? I appreciate your question and everything. Maybe Dr. Marsh, you can answer this for us.
Yes, thank you, Annie. We have plenty of ventilators in our supply catch, and we work closely with the hospital systems and the hospital association, but also through the DHHR and our inventory. We maintain a set inventory of at least 50 ventilators in excess all the time. So we are not having any problems identifying ventilators to use. The hope is that as we see this surge with COVID-19 start to reduce in the following 2 to 4 weeks after we would predict that the hospital numbers will also start to decline, and that will reduce that pressure that the hospitals are seeing right now. Thank you.
All right, thank you, Andy. Next to Anthony Kahn with WCHS and Fox 11.
Morning, everyone. Anthony Kahn with WCHS TV. Going back to the possibility of a government shutdown, Governor and anyone else, how do you anticipate this impacting the state? Specifically, national parks come to mind, particularly New River Gorge. Thank you.
Well, Anthony, first and foremost, I don't think it'll ever happen. But if it does happen, the parks will close for, excuse me. Let me just pause just 1 second and everything. Brian, maybe you could get, as far as our state parks, it don't affect it anyway. Okay, Anthony, I just want to make sure that I'm right in what I'm telling you. I was, from the standpoint of our national parks, yeah, our national parks will have to close. But as far as our state parks and everything, it won't have any effect whatsoever.
All right, thank you, Anthony. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. While Mark Curtis was out of town, I started to get emails from Putnam County, which is a bit out of my area, but their concerns are legitimate. I'm hearing from mothers that they have elementary school kids and they're sending them to school and they're not convinced that the mask mandate they have in Putnam County is good enough or to protect their kids. Governor, I know you've answered the question before as to whether you would do a statewide mandate and you want to have local control. Has there been any thought to giving that local control to the health officer in the county rather than the Board of Education? I know the Board of Education is elected and the health officer is appointed, but a pandemic is more of a medical issue than an education issue, although it impacts education. Thank you.
Well, Paul, the one thing we've done, and I'm proud of this, we didn't try to mandate stuff from a state level and push it down on our local levels, did we? We let our local officials make their own decisions. Pocahontas County still remains in the green. Pocahontas County is the only county in the state that doesn't have a mask mandate today. But they've been one of the only county, if not the only county in their state that stayed green. Absolutely, local control is what we should be doing, and what we did here and everything, it worked. It worked. As things got worse and worse, people reacted, and people reacted along the way. Now, say what you want, but it has worked. Now, from the standpoint of in Putnam County, they probably have a little bit of a modification of the mask mandate that some other counties, maybe like Kanawha or whatever like that, may have. But really and truly, Paul, they should make that decision. They know their schools better than we know them here in Charleston. They should make the decisions, and from the standpoint of their local control and everything, I hope and pray that it'll continue to work. I want to just make just want to pause just 1 second and see. I think that's it. I think I've covered it. I think I've covered it as best I can. From the standpoint, like I said before, I think the folks in Putnam County need to continue to look at what's going on, and I'm sure they're monitoring everything that's going on in their school systems and so on. But I think we've done a good job in making the choice to let the local people, make those decisions, and they've made the decisions, and they've made good decisions as we move forward and everything. And again, I just reinforce, look what's happening in Pocahontas County, and look what's happened all across our state as we've progressed and we've turned more and more and more counties red. We had more and more action on the local levels, and so So I think it's worked, and I think it's worked really good.
All right, thank you, Paul. Next to David Beard with the Dominion Post.
Hi. Wanted to follow up on General Hoyer's comment about getting educated about the vaccine. We know the challenges of social media. I see posts and memes every day with out of context stuff about exosomes and T cells and ivermectin. I know someone who won't get a vaccine but will order over the counter or mail order ivermectin. And it doesn't seem like it's easy or possible to have a rational discussion because both sides get emotional. I wanted to ask the doctors and General Hoyer what you do when you encounter that kind of issue. How do you respond to them? And do you have any recommendations for carrying on civil discussions when both sides are so far apart? Thanks.
General, you be the governor right now just for a second, General.
No, thanks, Governor. David, I think, the governor talks about this with us on a regular basis, that we've just got to continue to keep to the grindstone and put out what is accurate scientific and medical information and try to be civil in our discussions with individuals from across the state, that what is factual and accurate information. And I know too that our discussions with Linda Lanier and her son Joe, who I found out again this morning is improving, but has been in the hospital for a couple of months now. And we have some other folks that we're going to bring on with the governor to tell the story. I think we've got to tell the story of those people who have experienced the devastating impact of what this virus can do to them and their families, to make sure that people understand the value of what is available to us with that vaccine.
To me, just one second, Jordan. The general is I don't know how you've gotten so diplomatic. I mean maybe when I said you be the governor for just a few seconds, you turned into a politician on us, because when I'm with you, you're not diplomatic like that. But nevertheless, let me say this. He mentioned a great West Virginian, a heck of a man. When he mentioned Linda and Joe just a second ago, and Linda Lanier and her son Joe, and I hadn't gotten an update in the last couple of days, but to hear that Joe's doing better, wonderful. And we're really proud of you, Joe, and love you with all of our soul, and we want you well, and I know it's been a heck of a fight and everything, but thank you for all you've done, and hang in there. And we're going to continue to hope and pray you're well soon, and everything is just wonderful. But I'd like to say one other thing, and it's just this, is we want to be respectful to others, do we not? I mean, we don't want to, David, your question is so good, but we don't want to get in a food fight with somebody. Sure, it's frustrating. It's probably frustrating to both sides. And both sides have merits, and that's why this great country is founded upon all of our freedoms and everything. We want to be respectful. Now, with that, all I would say is just this. You're dead right, David, and the Johns Hopkins doc, the head of all infectious disease at Johns Hopkins, said the number one problem that we have across this land is social media today, because social media distorts everything all the time. And then people choose one pathway that's the easiest pathway, is just say no, because they're nervous or they're anxious. I mean, he had it dead level, right on the money. Now, with all that, I would just say this to everybody. If you're just strolling down the street and some way you stumble off the sidewalk and a car runs over your leg and you're bleeding like crazy, I don't think at that point in time you're going to choose getting to a doctor as quickly as you possibly can and having a doctor try to save your life. I don't think you're going to choose looking up on your phone, Facebook, and what's going on and all that. I think you're going to choose trying to get to a doctor as quickly as you possibly can. And all I would try to tell everybody is just this. Just talk to your doctors. Just talk to the people that know. Just talk to the people that have good medical advice. And then make a decision. And then make your decision. But for crying out loud, I'll promise you, if you're laying out there in the road bleeding, you're not screaming for an update on Facebook. You're not doing that. You're laying out there screaming to get to a doctor. And so that's who I'd be listening to.
All right, thank you for the question, David. Governor, I'll turn it back to you.
General Hoyer said that in 2016, before I ever became governor, we waded to mud, and we did. We waded to mud together, somewhat either looking for bodies or trying to help others or help others to be able to clean out their homes and everything of all their possessions. I've never been through anything as far as a weather disaster of that magnitude. You know, if you just think about it, home after home, all their memories, all their possessions, they were loading up with shovels of mud and everything else under the sun and carrying them out and dumping them in a pile in front of their house. And then along came, you know, a National Guard inloader with a dump truck. And the inloader would gather up the stuff and dump it on the truck. And then off the truck would go to some landfill or some designated area and dump it. All their pictures, all their memories, all their everything, just thrown in a truck and gone. And those were the lucky ones. Those were the ones that really hadn't lost loved ones. Those were the lucky ones. And we lost 23. And it affected every single one of us across this state beyond belief. Did it not? Everyone. We talked about it. We did everything under the sun. We studied how to prevent things from happening in the future and everything over and over and over. And he just told us, that good general just told us that we have a situation here right now today that is 158 times as bad as that. We got to act. We got to act. That's all there is to it. Listen, the last thing I'd leave you with is just this, and I want to talk about a really good man. I want to talk about a man that served this state and served this state unbelievably, and that's Ted Cheatham. You know, Ted is retiring from his post with PEIA, you know, and he's done an incredible job. I want to read to you just a couple of things about Ted Cheatham. You know, he's been at this post since 2006. He was a U.S. Army veteran. He holds degrees in finance and personal management. He has an MBA, and he also has a law degree. He served this state really, really well. In a position a lot of times that people probably cast a lot of rocks, but he served this state and served this state really well. Today, I am announcing that Jason Hott, who's worked with us and everything, and he's been our current chief financial officer of PEIA, will be taking the interim position of Ted Cheatham. Now, with all that, I would only just say just this. PEIA, from the day that I walked in the door till now, you know, we've not had an increase in premiums to anybody at any time. We continue to try to help. We put $110 million or $105 million in the PEIA fund to staunch it up and everything, and into a rainy day fund for PEIA. And we continue to try to help, and we had discussions today on how we could even help more as we go forward. Now listen, you got a lot of people out there in the state of West Virginia. We all expect, our medical premiums to go up, and go up, and go up, and they haven't. And really, I'm really proud of that, but it's on top of all that, I would just say this, that this day and time today, we need to try to continue to step forward and help our people in every way if we possibly can. So with all that, I congratulate Ted. I thank him for his service beyond belief. I mean, there's going to be times when people retire and people move on and everything else. Our cabinet is functioning really, really well. And so, again, congratulations, Ted, and thanks from every last one of us. A great, great job, well done. And Jason, now you got big shoes to fill, and we wish you the best and everything, and we're going to keep moving absolutely north. So thank you a bunch, and like I said, I guess I'll end with that. And the only other thing that I can say to you is just take heed to all that we're saying here. It's really tough when you sit here and read 74 great people, but nowhere close as tough as it is for those families, all those people that are those loved ones. Keep them in your prayers, West Virginia. We're going to get through this. If we're at the peak, that's good stuff, but we're not going down yet. We've absolutely still got a ways to go. Hang tough, West Virginia. Get vaccinated. Thank you.